Dear colleagues, dear distinguished guests, dear partners, welcome to the launch of the Health Systems for Early Childhood Development Initiative, jointly supported by UNICEF Regional Office for Europe and Central Asia, World Health Organization Office for Europe, and the International Step-by-Step Association. You will see that you can choose your language channel, but by going on the little globe that you see presented on the slide, and choose one of the 4 languages of interpretation offered: English, Russian, Albanian, or Montenegrin, for which we hope that our colleagues from Croatia, Serbia, Bosnia will also be able to follow. During the event, you can leave your comments and questions in the chat, and we will do our best to address them. This launch event is also being recorded and live streamed on the International Step-by-Step Association's YouTube channel. You may access the recording after the event as well. We can move on to just quickly show you the agenda that is very rich, and we will learn about the initiative and its relevance from different perspectives. We will start with the welcome speeches from the regional directors, and then hear a perspective of a policy-making level directly from the Minister of the Government of Montenegro. We will continue with the reflections from the distinguished experts, associations, and practitioners, and hear more about the initiative's website, a hub for joint learning and exchange. I hope that we will keep you interested and engaged. And we can move and really start the event. And let's start it by hearing from the leaders of the 3 organizations that have established the initiative. Those are World Health Organization, UNICEF, and International Step-by-Step Association. The first message will come from the joint statement from Afshan Khan, Regional Director of UNICEF Regional Office for Europe and Central Asia, and Hans-Henry Kluge, World Health Organization Regional Director for Europe. Mrs. Khan and Mr. Kluge were not able to be with us today, but have jointly sent a strong message on why UNICEF and WHO came together and how will they further support this important initiative in our region. Let us see their message.
Dear colleagues, partners, health professionals, and friends, it's a pleasure to greet you at the launch of the Health Systems for Early Child Development Initiative, which will contribute to better health care for young children and families across Europe and Central Asia. Driven by our commitment to support every child to develop their full potential, UNICEF joined efforts with the World Health Organization's Regional Office for Europe and the International Step-by-Step Association to strengthen health systems and build the capacities of health professionals to better support families for optimal child development. Allow me to thank the European Union for its financial support in developing this initiative. This will target countries in the Western Balkans and benefit the Europe and Central Asia region as a whole. I'd also like to thank the experts who guided the setup of this initiative and the development of its platform.
Dear colleagues, partners, and friends, it is a great pleasure to speak to you at the launch of the Health Systems for Young Child Development Initiative. Together with UNICEF and the International Step-by-Step Association, we are committed to support the transformation of health systems to put young children and their caregivers in focus. Working together to improve the health and well-being of young children and their families embodies the vision of European Program of Work, United Action for Better Health, leaving no one behind.
We have so far achieved great progress in reducing young child mortality across the region. We now need to continue working together to make sure that every child can thrive. The early years offer an unparalleled opportunity to support the optimal physical, social, emotional, and cognitive development of all children and build the foundations for lifelong health, well-being, and productivity. To thrive, young children need nurturing care conditions that promote and safeguard their health and nutrition, provide security and safety, as well as opportunities for early learning and responsive caregiving. However, 1 in 5 children in Europe and Central Asia are at risk of not developing to their full potential due to lack of nurturing and stimulating care in the family, poverty or social exclusion, or limited access to essential services. We can change this, and this initiative gives us tools to act on these inequities, starting as early as the next health visit or a health checkup.
Health professionals are uniquely positioned to support and positively influence child development and the quality of caregiving. During the first years of life, our colleagues are in frequent contact with almost every pregnant woman, newborn baby, young child and their family. Health professionals are trusted by families and communities. They deliver essential healthcare to children through preventive measures, immunization and treating sick children. All these points of contact offer great opportunities to support the holistic development of every child. To make the most of these opportunities, we recently published a pocketbook of primary healthcare for children and adolescents, which provides doctors, nurses and other health workers with evidence-based recommendations on early childhood development, prevention, promotion and treatment from birth. We are here to support health systems and professionals to apply new evidence on early child development and ensure that healthcare services go beyond the focus of physical health. This extended focus includes monitoring child development and offering support to parents in providing children with nurturing care. This approach goes back to WHO's definition of health, not just the absence of illness, but the state of overall well-being. The new paradigm of healthcare for young children relies on a renewed partnership between health professionals and families, and it requires a broad collaboration in which we all need to come together: WHO, UNICEF, ISSA, governments, and particularly health professionals.
The new dedicated platform, which we are launching today, is our first tool that offers evidence-based resources and knowledge on holistic care for young children and their families, for professionals and policymakers in our region. UNICEF stands committed to continuing its close collaboration with governments and partners to shift current models of healthcare for young children. We invite you to use these resources and share them with your networks. We also call on all of you to act today so that every child in our region is able to thrive.
System change is complex and can only be achieved through clear intention, good planning and firm commitment. I invite all colleagues shaping health policies in the European region to join in the transformation of health systems so that they respond adequately to the needs of young children and their families. The future of child development starts with healthcare. Please make it count.
It was really great to hear the strong commitment from the regional UNICEF and WHO leaders. And we are very glad to have with us Liana Gent, Executive Director of the International Step-by-Step Association, as the third founding partner of this initiative. And Liana will welcome you in person. Over to you, Liana.
Thank you very much, Alex. It is an honor for me to address you all at this launch. As ISSA, we are delighted to be working in partnership with UNICEF's Regional Office for Europe and Central Asia and with the World Health Organization's Regional Office for Europe on this new and very inspiring initiative. Thinking back this last year, the period to prepare this initiative has been a wonderful illustration of a strong partnership where all partners leverage their strengths and assets. This initiative has an ambitious goal to change the perspective on the role and capacity of the health systems to support early childhood development. And this is something that as ISSA, we have heavily invested in over the last years in partnership with partners like UNICEF and WHO by delving deeply into ways of bringing early childhood development into health systems across Europe and Central Asia, but also linking the sectors which are responsible for services for young children and their families. Through this initiative, as we join forces, we aim to promote values of such intersectoral cooperation to build learning community across different roles and levels of the system and of sectors. For us at ISSA, this approach has added value since, as at the core of our approach, we promote and implement policies and practices based on the values and principles of the nurturing care framework. In other words, to put families with young children in focus and create welcoming, nurturing, stimulating and inclusive environments in which every child has the opportunity to reach their potential. In this partnership, as a network, from ISSA, we commit to leveraging all our experience and all the mechanisms we have in place to generate together with partners new knowledge, to offer channels for dissemination, for instance, webinars, blogs, new resource modules, and also to be a catalyst and facilitator for learning and sharing. So for all of you who are with us today, this is what you can look forward to from this partnership. From ISSA's side, we will be leading the dissemination activities, including the development of the brand new website for the initiative, which we're launching today. And it is a privilege for us to join forces in this initiative with the partners, but also to share this special moment of the launch with so many participants in the event today. We see we are joined by over 400 participants from different corners of Europe and Central Asia. And what a joy for us to share this launch with all of you today and to work together for young children and their families in the future. Thank you very much.
Thanks a lot, Liana. Thanks a lot for your words and for being such a great and committed partner. And as you have heard from the opening remarks, one of the important aims of this initiative is really to influence policy changes. And that is why we are particularly honored to have with us a representative of the highest level of policymaking in health, the Minister of Health in the government of Montenegro, Mr. Dragoslav Čekić. Mr. Čekić is already a champion in this region and dedicated to making health systems serve young children and their families even better. Mr. Čekić, welcome, and the floor is yours.
Thank you so much, Ms. Khan, representatives of the WHO, and all other participants. Warm greetings from Montenegro. I wish and I hope that very soon we'll replace these online meetings with in-person meetings. I'm glad that we are here together to discuss what's important to all of us, children and their early development, at the regional conference that was held on November the 5th in Podgorica. We emphasized that recognizing delays and problems with issues with child development at an early age is the most important and crucial in our efforts to ensure their realization of their full potential. I would like to confirm on behalf of the government of Montenegro that health protection is high on our agenda of political priorities. Healthy growing up is an imperative for us. It has to behind that, all political actors and all other members of the community have to take their full participation. And the first and most important segment here is the healthcare for the youngest in our society. With the great assistance of international organizations, primarily the UNICEF, we are on the good track to make sure that this most important segment of our society is substantially improved. We are thankful that international organizations recognize our efforts and measures to be taken to ensure improvement. I will try to, in a nutshell, present what we have been undertaking in this area. We have been implementing the program to support breastfeeding with the special focus on developing child-centered birth units. Also, we have started in developing the strategy for early development of children with guidelines and protocols in this area. With the new provisions in the law on health care, we will make sure that early screening for rare diseases in newly born measures are introduced, prevention, prenatal care, assistance in healthcare centers and in maternity wards, and we'll place special accent on education and training for healthcare professionals so they are trained and able to identify early signs of diseases. The sooner we detect diseases, the chances of ensuring that children get better are higher. Also, the Autism Center will be renamed to a Center for Early Child Development Center that will have all relevant diagnostic procedures, and it will be at a place where parents and children can get the necessary assistance of relevant experts. In order for us to achieve the goals in this area, the assistance and support of UNICEF and World Health Organization is crucial for us. Early child development measures with a focus on health, nutrition, and improvement of the health of children at the early stage of their development, as well as with the improvement of health of women with the accent on prenatal care in maternity wards. All these measures are fully aligned with the priorities of the government of Montenegro and the health ministry as a policy maker in this area. I'm glad that our efforts have been acknowledged, and I fully appreciate your invitation to include Montenegro in this initiative launched today by UNICEF and WHO. I believe that in our we will be able to tell you more about activities at the conference, the high-level conference that will be hosted by Montenegro at the initiative of UNICEF. That was agreed with the director Afghan Khan in Geneva. Dear friends, I hope that this discussions today will greatly contribute to achieving our goals in this area. Thank you once again, and warm regards from Montenegro.
Thanks a lot, Mr. Cekic, for your great commitment and the vision, and we are looking forward to continue our great collaboration. With ministers like you, we see great progress of this initiative. Thank you a lot. Dear colleagues, policymakers are crucial in building the enabling environment that will support system change. Luckily, the rationale for this change is supported by a strong evidence generated through research over the past years. This evidence has been put in practice and validated by many passionate professionals and experts who have been paving the way for developmentally oriented healthcare through their work and research. One of them is Dr. Ilgi Ertem, professor at the University of Ankara, founding member and the member of the executive board of the International Developmental Pediatric Association. Professor Ertem is also a member of the technical advisory group of this initiative, a group of renewed experts and practitioners that has provided invaluable contribution to the shaping of this initiative and ensuring its relevance for the region and beyond. We are fortunate to have members of the Technical Advisory Group with us today as speakers or contributors to other aspects of the launch event. We are delighted that Professor Ertem will deliver the keynote presentation today, and I kindly invite her to start. Over to you, Ilgi.
Thank you so much, Alexandra. I will share my screen first. You can see me, you can hear me, right? Okay. And can you see my full screen right now?
Okay. Yes, we can.
Okay, thank you. Thank you again, Alexandra. Thank you, the WHO, UNICEF, ISSA, for bringing this together. Mr. Cekic, it was wonderful to listen to your talk, and we are so delighted that a minister, one minister at least, is saying these words and is embracing this initiative. So, health systems for early childhood development. I wanted to share with you why we need this, and what is it we are going to be doing. So why has healthcare systems lagged behind in early childhood development, and they have gone forward in child health? As it was pointed out in the opening, we have brought down mortality. It's not as if this is a new thing. It is quite old. In fact, it is a millennium old, this concept of supporting early childhood development in healthcare. And in the past 20 years, Lancet has brought out 3 series highlighting the importance of this. There is a Nobel Prize winner on this. Heckman's research has been out there for many, many years. We know that it is, if we invest in this, we only gain. And there is a cost of inaction. Now that is being talked about. ACTAN has an amazing tool where countries can, in fact, calculate their cost of inaction, of not doing this, of not bringing early childhood development focus. The WHO has done tremendous work on this for many years. And 4 years ago, they brought the Nurturing Care Framework, which can help us, which can give us the content of what we are supposed to do. And this is the WHO. This is an institution, a worldwide institution that knows about healthcare systems. So it's not as if we don't know how to do this. And the other thing which was pointed out in the opening by Dr. Kluge was that there are touch points in the health system. Healthcare providers are probably the only, globally the only professionals who reach families at multiple points and are trusted. So why is this lagged behind then, if we know all this? One of the reasons is that we have been misguided by the mortality argument, that mortality is so high that we don't have time to address early childhood development. And yet this is a misguiding because of the fact that childhood mortality and development go together. So any program that's going to highlight early childhood development is going to also be addressing mortality. The importance of the child will be emphasized, and how to get the child to develop is also how to get the child to live. So this is extremely important, I think. Another reason has been that we have been misguided by screening. So yes, programs for, as Dr. Cekic highlighted, there have to be programs for screening, but these are for early detection of problems that are there and don't happen later, right? So for example, like phenylketonuria, but monitoring child development is the way to go. Monitoring and supporting is the way to go for child development, not to screen at cross-sectional time points. So those are global misguided issues. But in our region, and probably specific to our region, we are also misguided by non-evidence-based treatments and polypharmacy. And this, I would like to thank Dr. Martin Weber for leading us into this study of how prevalent this is and what are the issues. There are many therapies in our region being used: massage therapy, Pavlovian behavioral techniques, and only those, hyperbaric oxygen kind of techniques. And then there is huge polypharmacy. Even today, there are millions, perhaps, of children receiving drugs for development, which are actually not even licensed to be used for children, let alone for any problem. So how can we turn this around? I think this effort was needed. It's not like another launch. It's not like another website. It's not like another group coming together. I think it will be a very definitive group to help us go back into theory. So in Leonardo da Vinci's famous words, "He who loves practice without theory is like a sailor who boards a ship without a rudder and compass and never knows where he may cast." So I think that we have lost the theory of child development, and we have in pockets tried to do things about child development, but the theory has been lost. So if we revisit theory, we know that the child does not develop alone, and you cannot just look at the child to address development. You have to do it within the context of the family and the community, and you have to be in relationship with it. So health services, which come closest to this, constellation, need to be partners with this family child system. And so I call this, the American Academy of Pediatrics and the CDC have the slogan, learn the signs, act early. I think that this is another misguiding for us. It is not learn the signs, because you cannot just look at children. So what we are calling it is revisit theory and add ECD. So are there frameworks for doing this? Yes, the nurturing care framework, the pocketbook, which has been talked about, that the WHO, the regional office of the WHO has brought forth. This is there, and everything I'm talking about actually is there. There are programs. We have a program of ADCD, which includes the Guide for Monitoring Child Development. In Italy, there is the Village to Grow Together. There are multiple programs in our region which are based on the things that I'm going to be talking about. So, but what is, simply said, what are the questions that we should be asking ourselves to see if we are doing this the right way, and the theory-based way, the right way being the theory-based and the evidence-based way? So we've come up with 10 questions that each healthcare provider and healthcare systems policymakers can ask themselves about whether they're on the right track. So, do I inform families about the importance of early brain development? Do I ask families if they have concerns about child development once I've told them what this is? Do I learn about the nurturing care environment that is already being promoted in the home, so that I'm not repeating what they're already doing, and I am not wasting time if the family's doing a great job, but reinforcing their strengths? Do I learn about health-related and psychosocial risk factors that will impede development, and also about how families cope, their strengths and their resources in the communities? The photos I have here are to show you that the answer can be yes, that this can be done in the region. They are a group of photos that pertain to our work in the region, in Turkey, in Azerbaijan, in Kyrgyzstan, in Turkmenistan. So this can be done. All these questions can have a yes, I'm doing this kind of answer. So I'll continue. Do I use theory and evidence-based, culturally appropriate tools to monitor development, to identify difficulties and the need for support? Is my assessment meaningful? Not just a score or a delay, not delay kind of an answer. Do I inform families about their own child's development, or are these just very general? And how they might use activities, participation in life and in nature to help their children develop. If the child needs extra support, can I formulate reasons, provide individualized support and close monitoring? Do I learn about the strengths of children and families? And can I empower families by mirroring their strengths? Do I educate families about neurodiversity and help them address stigma? Can I guide families to appropriate, accessible, evidence-based, family-centered services in my country? Can I help these kinds of services come to front and be chosen? Now, as far as policymakers, I think here are the two questions that are key. Or three questions. Is every health provider that I have in my system trained to say yes to all of these questions? Does the healthcare system enable providers to put theory into action? Because if you don't give them time, even if they know all this, they're not going to be able to put it into action. Am I giving them funds? So there are reimbursement systems in some of our health systems. Are these being done on their own time, or am I in fact supporting this? Does advocacy enable progress, follow the science, listen to children, families, and service providers and other similar countries? So the South-to-South collaboration, even in this region, I think is extremely important. Now, you may think, you know, I listen to myself and sometimes, what a dreamer, right? Is every health provider ever going to say yes to these? And I do think that they are, because I've seen it happen. And I've seen it happen in many countries. We teach health providers, here on the left, the skeleton symbolizes anatomy. We teach them tons of anatomy that they're not going to use. We teach them to look at the microscope, even identify cancer and this and that, and they don't even see a microscope in their lives. But we teach them to listen to the heart and the lungs, and of course we should, but rarely do they use that in primary health care. Yes, in some instances, of course, these need to be taught. But can we not teach them the simple science of early childhood development? I don't believe that there is a reason we cannot teach them that. It has to be in the pre-service education system, and it has to be in service. And they can learn it. It's sometimes too easy for them to learn. And sometimes I wonder if this is also a misguidance, that it's so easy. So I will just end. I do think I have time. So I'll end with a video. And this is a video of how this can be done, that it is doable. This is a little boy with Down syndrome, diagnosed with leukemia on top of the Down syndrome at 2 years of age, hospitalized for 6 months. No services were available. There was just his bed, his mother and his father, which you will see in the video. His doctors and nurses knew about child development. All they said to this family is early brain development is important. We can't wait to treat his cancer, then support development. It has to happen together. Supporting development is in your hands. Let's see how the father and the mother are doing this in a hospital bed.
Göz yapalım mı dedi 2 tane? Burun yapalım. Burun orada. Ağız yapalım bir tane. İçine dişler koyalım. Mete'nin dişleri nerede dişleri? Evet, o dedi. Ayakları nerede ayakları Mete'nin? Orada. Ayakları kokuyor mu? Öf mü? Bakayım böyle.
Peter smelling.
Mete de koklasın. Nasıl kokuyor Mete ayakları?
Uçak uçuyor. Bilmiyorum. Aferin sana. Peki kelebek nasıl uçuyor?
Sarı limon nerede? Nerede sarı limon? Evet.
Ay, Mete'nin kalbi geçiyor.
Thank you so much for this opportunity of sharing in this wonderful launch, and I wish you all the success. Thank you.
Thank you, dear Elke. Thank you for your continuous motivation, for leading in this pathway, for providing us with such a concrete examples of what can be done starting today. And I believe that the change is happening, and this initiative will be just a backbone to support it to move further. Thanks a lot for your presentation. Today, we also wanted to make sure that one of the key actors in introducing the new practices, pediatricians, are strongly represented. I have a pleasure of introducing Dr. Stefano Del Torzo, Executive Director of the European Academy of Pediatrics. The European Academy of Pediatrics has a mission to promote the health of children and young people in Europe and aims to improve standards in training, service, and research, and to represent the professional interests of pediatricians in Europe. Dr. De Torzo, we are looking forward to hear how do you see the relevance of this initiative from the perspective of the pediatric community. The microphone is yours.
Thank you very much. It's really a privilege to represent the European Academy of Pediatrics, considering that pediatricians are undoubtedly among the most trusted health professionals for children care. For any pediatricians, early child development obviously includes not only psychomotor development, but also monitoring physical growth and vaccination hesitancy, which do indeed influence early child development, sometimes in a vicious circle, not allowing children to develop to their full potential. In this activity, nurses and GPs are also involved in many countries, and teamwork, therefore, is essential to achieve proper care and regularly updated continuing medical education and continuous professional development in the science of early child development must be guaranteed for all the health professionals involved. In the era of digital health, it is important to have a European standardized system to monitor developmental milestones, also to facilitate healthcare across borders. Electronic health records should be used to support continuity of care and shared understanding of care needs. Reciprocal trust, parents, pediatricians is essential to achieve an optimal early child development, as has been shown also in the video we have just seen. And there is much greater need for evidence gathering on the experience of children and their families, and maybe also for the inclusion of young people in community advisory groups on their needs. Family-centered health services should include tailored integrated care in the community, which can be achieved through a trusting relationship between the parents and healthcare providers. Well, now the issue is how to motivate colleagues to revisit theory, as it has been said, and enter or re-enter the field of early child development, stepping beyond the traditional approaches in education. It is not enough to expect that multidisciplinary working can suddenly start and be effective in practice. It must start in the classroom with interdisciplinary interprofessional education where possible, where there is shared education on early child development issues and shared interprofessional education on decision making. Working on ECD, focusing on prevention and health promotion is highly motivating for any pediatrician. It is extremely relevant for the European Academy of Pediatrics and the whole pediatric community. Thank you very much for this opportunity.
Thanks a lot, Stefano. It was really great to have you with us today. And thank you for your constructive reflections and proposals of the priority step, because we cannot emphasize enough the importance of continuous professional development and changes in the pre-service training. And we hope that we will work together to make that a reality. You created a very nice transition to the next speaker, who will provide more information about the concrete resources and tools that will support the aims of this initiative. So I have a pleasure to invite Evelina Borisova, Regional Advisor for Early Childhood Development in UNICEF Office for Europe and Central Asia, to walk us through the initiative and its website. Over to you, Eva.
Thank you so much, dear Alex. And it's a pleasure and an honor to be among so many inspiring speakers, colleagues, and joint visionaries. I think you've already heard quite a bit about the vision behind this initiative, but I take a moment to anchor the rest of the conversation in the platform that we have also jointly developed and launching today. We have heard from the welcoming remarks and from many of the guests who have spoken so far why this initiative was established and what changes it aspires to achieve in healthcare provision for young children and their families. Our vision, and I think now a shared goal among all of us here today, is to ensure that routine healthcare services go beyond physical health and incorporate critical guidance and support for early childhood development. This goal requires a change, a small change, perhaps small or big, in health systems and services to include attention to the child's social, emotional, cognitive, and overall development. I think this also means that healthcare services need to be more family-centered, as we have heard from many of the speakers so far, and focused on the child as well as on the caregiver, or the most important adult in a child's life, who provides nurturing care for the child. That's our joint vision. You can move on to the next slide. We would like to make every healthcare encounter count. And I think that means both in healthcare facilities as well as in home visits. The initiative focuses on these 4 key thematic areas. And to break them down a little bit further, and I think Ilge has set the tone beautifully in all the important aspects of early childhood development that need to be integrated. What the vision we have is that each touch point, either at home or in facility, would ideally do the following: provide support and guidance and counseling for parents on all aspects of nurturing care, address parental concerns, because these are really important in how a parent is then able to follow through, monitor child development based on validated tools, identify important risk factors for developmental difficulties and support the parents for nurturing care, and for children with more complex and additional needs, coordinate the care and refer to other sectors and services to ensure access to early childhood intervention service and supports as well. It's not a small matter, but it is possible, as we have heard. And on to the next slide. How do we make this impact? I think the vision is clear, we hope. The fact that we're all here together is also an amazing start to this joint vision and to building a strong community that we have started today. And we want to do more, and we need to do more. Through this initiative, we would like to reach out to policymakers, decision makers, program developers, regional and national partners, professional associations, and all institutions who support capacity building of health professionals, because we have heard just how critical that is in engaging and supporting this change. The initiative has 3 pillars, so to say, of our work, and we look forward to engaging you all in these pillars. The first one is, of course, advocacy. because we are building a vision, we are building a momentum, and advocacy for change is going to be critical, of course, regionally, but also nationally, and perhaps even subnationally. We aim through this initiative to provide key stakeholders, both at the regional and national level, with the knowledge and the tools to expand your joint advocacy efforts and to enhance healthcare systems' capacity to work towards this vision. And we really hope that through advocacy, we would also be building some new partnerships in support of holistic care for young children. The second pillar, very important in order to have strong advocacy, also curating core knowledge and making sure that the key evidence and the right resources are at your fingertips. This initiative seeks to do that as well. We look forward to disseminating and curating contemporary evidence-based guidance, resources, and expertise on early child development for healthcare practitioners and professionals to inform and guide policy change, advocacy, and of course, the practice of practitioners on the ground. And finally, and very importantly, the third pillar of the initiative and how we hope to create an impact is by creating a community of practice. And again, we're here today. That's already a great testament of this third pillar of the initiative. And we look forward to building a learning community among stakeholders at both national and regional level in supporting the exchange, supporting joint learning, as well as knowledge creation. Because while a lot of tools and resources are already developed in this area, we also recognize that additional resources and learning might be needed to make sure that we reach the goals that we have set. The new dedicated platform, which we're launching today, is our first tool towards these goals and really offers already evidence-based resources and knowledge to health professionals and policymakers in the region. And I would like now to take a moment and share a short video of the platform. I hope that colleagues would be able to play it for us.
Welcome to the Health Systems for Early Child Development website. This website is a one-stop shop, curating contemporary, evidence-based guidance, resources, and expertise on developmentally oriented health systems in Europe and Central Asia. Designed to be used on your laptop, desktop, smartphone, or tablet device, the website homepage provides a snapshot of the website's key areas. Interested in the initiative's perspective? Visit the Health Systems for ECD page. Here you can find important guidance documents and more information on our vision of the potential of healthcare systems to support early child development. The website's Knowledge Hub is organized around 4 thematic areas: facility-based healthcare, home visiting, developmental monitoring, and supporting children with complex needs. On this Knowledge Hub, you can learn more about how support for early child development can be strengthened across each area. Get immediate access to all the website's resources on our Knowledge Hub page, or navigate by thematic area. To find a specific resource type, you can use our filters. Search for tools, recommendations and guidelines, advocacy documents, and documents related to the workforce. You can also use the advanced keyword search function to find what you are looking for, or you can sort through resources alphabetically. When you find a resource you are interested in, click View to access the resource. One of the key aims of the initiative is to create a learning community and facilitate exchange and learning about promoting child development through routine healthcare across the region. The website's Share and Learn section lays the groundwork for our community to engage. Here you will find information about online courses and blogs written by experts. You'll also find information about past and upcoming webinars and events from the initiative. Interested in how you can engage with this platform? Contact us. Help us improve the website via a short survey. And stay tuned through our mailing list so you never miss a new resource, blog, or learning opportunity. We hope to see you on the platform soon.
Thank you so much. And just to reiterate that the launch of this platform is really just the beginning. And we look forward to supporting all the webinars covering key priority areas, experts writing and blogs that are forthcoming, as well as featuring new guidance and resources that we hope to hear from you need and want to see on the platform. Most importantly, we really look forward to this joint momentum that we're building today and having a breakthrough through this initiative and through everything that's forthcoming on the platform. Over to you, Alex.
Thanks a lot, Evelina, for the great overview. And we hope that you all have a better idea of what are the different elements of the platform and that you started to think, how can they support you in your daily work? To help you in that task, we have invited our dear colleagues, also members of the Technical Advisory Group, to join us in a panel and share the voices from the field and from their practice. So we have with us today Dr. Kirill Soleski, family physician and founder of Group Practice, Senior Program Director of the Macedonian Medical Association from North Macedonia. We can see him on the screen. And Kristina Nedeljković, Head of the Home Visiting Nurse Service in the Health Center of Novi Sad from Serbia. Kristina, please also, if you can put your camera on so that we can enjoy the next few minutes with both of you, because I have the same question that relates to both of you, and that is, what are the practices that you are applying in your daily provision of healthcare that are supporting child development, and how do you see that this initiative and platform can support you in your work? I can see Kirill, and we hope that given your professional background, we hope that you can reflect from the perspective of the family doctor working with, particularly one working with children with complex needs. And Kristina can reflect from her perspective as a home visitor. So Kirill, would you like to start?
Yeah, thank you, Alexandra, for the introduction, and thanks for the step-by-step organization and UNICEF for this invitation. I'm very humbled to be part of this launching. I will speak from my experience as a doctor practitioner and also as a program director in Macedonian Medical Association. As a family medicine doctor in my group practice, me and my colleagues, we help the parents every day to understand the importance of brain development and how children develop during early years, monitor child development, elicit from the parents any concern about child development, and we provide guidance on how parents can enhance child development. Sometimes some children may need additional support, like children who are delaying the development, children with disabilities, or children with complex health conditions, or they are living in poverty, or they are living in environments where there is a domestic violence. These children, we try to connect to the needed health services or the services in the community. Another thing that is essential also is to protect children's health. To protect children's health and development is the care of their parents gets to make sure that they are in good health before they conceive. We think that care before pregnancy improves a man's and woman's physical and mental health, and also reduces the chances of their child being born prematurely with low birth weight, and also birth defects on other birth-related conditions that could hinder optimal development. In these earliest years, as we see in the previous presentation, the health sector and we as a health professionals, we have uniquely positioned. We are uniquely positioned to provide support for ACD and also for nurturing care. My experience as a program director in my organization is that we developed several programs and implemented several programs in partnership with UNICEF. Programs that help health professionals to understand, which is very important, to understand the importance of monitoring ACD in their routine work. We introduced several training programs for early detection, early intervention in CVDs, screening program for autism and other development delays, ICF pilot in primary care, and promotion of positive parenting. So I think that this is one of the best way a country like ours and other countries in this region, one of the best way to boost prosperity and to promote inclusive economic growth is to invest in early child development. And on the second question that you asked about how this initiative, and this college knowledge hub will help us in our everyday practice. I think that personally with me will be a very useful platform for exchanging the good practices on European, on Central Asian level, and also good platform to increase awareness for health sector role in ECD and nurturing care. And also, as I heard, I like these sentences that this website, I agree, that will be one-stop shop for resources on ACD-oriented health system in Europe and Central Asia.
Thanks a lot, Kirill. Thanks a lot, and we are looking forward to your inputs and in making the platform even better. And Christina, over to you. A dedicated home visitor with a lot of experience, but how does it look when you're supporting early childhood development through your work?
Well, thank you, Alexandra. As you said, my name is Kristina Nedeljković, and I'm the head of the polyvalent home visiting nurse service in Health Center in Novi Sad, the most prominent organizational unit of that kind in Serbia, and I suppose in the Balkan region also. Our service supports families during the early childhood development period in building a healthy, nurturing, supportive, and also playful environment for their children. We have a unique opportunity to model coach parenting practices within the family environment together with family members, including the child. This is what makes the role of the home visiting nurses outstanding in respect to other professionals addressing families and children at early age. Meeting families in their settings and homes provide us with the unique chance to understand and recognize the situation children and caregivers are living in, and the opportunity to create safe, enriching environment for playful and stimulating parenting. A home is a place where all the factors can impact the child's development can be observed, both positive and negative ones. In Serbia, for those who don't know, families are entitled to 1 visit during the pregnancy, 5 visits to a newborn, 2 visits during the first years of life, and 1 visit at the age of 2 and at the age of 4. My initial training focused my practice mostly on child's physical health and feeding practices in all these visits. Today, however, I proudly integrate support for both parents and the child. I coach mothers and fathers on how to develop warm relationships with their children, how to engage in playful interactions, and support child's development and early learning experience. Once the role of home visiting changed, introducing new scope, and we got the additional training, I was able to start implementing new approaches. Now, we aim to focus on all the nurturing care components, and we learn together with parents why is it important to communicate with child, to read and play from the first day of child's life, and how to integrate this art of parenting in everyday family routines. We support parents to notice and understand the child's cues and be responsive to child's needs. At the same time, we aim to be responsive to families' needs, to be aware of their parenting stress, mental health, gender, and the different contexts of life that may undermine their parenting competencies. I also believe that the Knowledge Hub will help me to continuously improve my daily practice. It will provide me with the newest data, examples of good practice, and it will offer me the opportunities to learn, to discuss, and to reflect of my work, of my role as a home visiting nurse in every day. So I think that the Knowledge Hub is very important for me.
Thanks a lot, Christina. Thank you for sharing all those wonderful insights, because they show, together with you, Dr. Kirill, and you, that the change lives through your daily practices, and that is more than possible. I hope that Christina and Kirill have managed to inspire all of you who are with us today and convince you that strengthening of the health systems to better support early childhood development is indeed important and feasible task, and that you will join us in the effort to make this vision a reality for every child and in her or his family. Let me now invite the representatives of the 3 organizations that have established the Health Systems for ECD initiative to share with us their closing remarks and let us know what to expect next. So, with thanks to Christina and Kirill, I invite Liana Gent from International Step by Step Association, who you heard from already today. I invite Martin Weber, the team lead quality of care and program manager of child and adolescent health from WHO Europe Office on Quality of Care, and Gabriele Fontana, regional advisor for health from UNICEF Regional Office for Europe and Central Asia, to address you. I kindly ask you to put your cameras on. Liana, Martin, and Gabriele. And Christina and Kirill, you can close your cameras so that we see Liana. Thanks a lot, Gabriele and Martin. I hope that all three of you are with us. I saw your names. And Liana, maybe you can start.
Yes, happy to do so. Thank you so much, Alex. How inspiring it was to hear all the speakers, and what a privilege to have so many experts and advocates with us today from so many countries, and not just Europe and Central Asia. I saw countries from other parts of the world. So I think our initiative is a pioneer that can hopefully inspire others. We hope that the launch event has shown the great potential of bringing more early childhood development into the health systems, as Ilgi inspired us. And here at ISSA, we are deeply committed to take this initiative forward. As a network, we will continue to contribute to this joint effort by using the added value that networks can bring, as a catalyst, as a knowledge broker, as knowledge generator, and a link, creating a platform together with our partners. We will harness the potential for health, for ECD development, for the website of the initiative, by creating and nurturing the learning community across roles, sectors, and countries, but also by connecting and empowering policymakers and professionals. These are the primary target audience for us, those for whom we created this initiative together. Additionally, from ISSA, we aim to use our in-house expertise and the expertise of our members and partners to create new knowledge, for instance, blogs and resource modules to support continuous professional development of all relevant stakeholders, with a very special focus on workforce and managers. And we are very excited to share more with you in the coming months and beyond. So we hope that you will engage with us, you will subscribe to the mailing list of the initiative, and do make a point to visit the website. You will find many useful resources, and indeed, as one of the speakers said, we hope it will be a one-stop shop for all of us. Thank you.
Thanks a lot, Liana. And over to Martin.
Thank you very much. And it's really great to see this initiative, and I'm very pleased to be part of it, and to see the enthusiasm with over 400 people joining today. Let me just make 3 points from the health systems perspective. Many of these points have been made before. We are dealing with quality of care issues here, and we know in many countries the quality of care which is provided for early childhood development and children with developmental needs is not great. So we need to change systems, and we need to do this jointly. I'm looking forward to work with all of you. You have heard from Ilgi also, it's not only for doing more, it's also for doing less, with some needless things, unnecessary screenings, unnecessary polypharmacy. And this is a big, difficult process which we need to really do jointly. You have heard about the Pocketbook of Primary Care, which incorporates early childhood development into primary care and into the whole context of child and adolescent health. We would like to move this forward as a job aid, which is complementary to the knowledge platform, and the knowledge platform supports all the practices in the Pocketbook. We are translating this at the moment already into several languages. For those of you who have not heard about it, please contact us, and we will try to discuss how we can translate it into your language. The second point is we need to establish referral pathways. For children who have specific needs, they need to be referred up to a specialist who can diagnose them and provide for their specific needs. But referral is not a one-way pathway. It has to go back again to the primary provider, so the care is provided for the children with special need as close as possible to their family. So this is a complex process. It's behavioral change. We need to work jointly on this, and I'm pleased to see all of you here to help each other to move this forward. Just as a final point, I think we are all clear, but we have to promote this, that ECD is an essential component of primary healthcare. And we need to work with countries to embed it appropriately. There are tools available which UNICEF and WHO have jointly worked on them, and they will be part of our future work and future webinars. Thank you very much.
Thanks a lot, Martin, for your kind words. And I ask Gabriele for his closing remark.
Thank you, Alexandra. Such a pleasure to be here with so many colleagues and friends. And we have very similar closing remarks, which we haven't really planned for, but it shows how we are converging on the same core issues. Building health systems capacity to support early childhood development requires commitment, and then a holistic approach that includes the capacity for developmental monitoring and for trigger interventions among primary healthcare professionals. It requires teams of professionals able to provide jointly early childhood interventions to children and able to put the families at the center of this process. It entails clearly defined mechanisms to trigger care from other sectors, especially education. Now, to make all of that happen, early childhood interventions need to be an integral part of the health services provided by the health system. We need political will, we need right policies in place, adequate financing, adaptation and use of tools, and capacity among health professionals. This is complex, it doesn't come easy. And that's why it can only happen with the commitment of all parties involved. This is why we're launching this initiative, bringing together governments, experts, professionals, academics, international associations, UN agencies. Only joining efforts we can make health systems work for early childhood development. From the UNICEF side, like everybody else on the call, we are fully committed and we look forward to work together on the different activities that have already been planned for the coming months. There are new and updated resources that are becoming available, including on home visiting, on early childhood intervention, with new webinars on the latest evidence-based approaches. The mailing list, I think it has been shared with the invitation to this call, will be the main channel for us to stay updated and in the loop. So if you have not subscribed to the mailing list, please do it. I think Liana already made a point. I want to reiterate it. Let's make the most out of this initiative in each country and the regional level. As we click on leave the Zoom meeting, the work continues and the effort has to be doubled. We're all together on this. Thank you so much.
Thank you so much, Liana, Martin, Gabriele, for the wonderful closing remarks, for reinforcing commitment of the three organizations, for reinforcing that the front supporting health systems for ECD strengthening is already wide and strong, and we remain committed to make it even better. Thank you for all of you who have been with us today, who have been part of the launch and stayed from the beginning all the way to the end. We invite you to visit the website. You can see the link to the platform that is live and start finding what you might need and what might help you in your daily practices with children and families. We are welcoming your feedback and suggestions and hope that you can leave them on the website to really help us, respond better to whatever are your needs. We are encouraging you to subscribe to the newsletter. That will be the simplest way to keep you abreast of all the new events and resources at the platform. And finally, a huge thank you to all our speakers, presenters, the distinguished minister, to translators, thanks to the technical advisory group members and committed technical colleagues from ISSA, WHO, and UNICEF. I hope that you will make use of the resources we made available, and hope to see you in one of the forthcoming events that will be hosted on the Health Systems for ECD platforms. Goodbye to everyone.